The Public Protector and her deputy are today visiting a number of health facilities here in Gauteng. This morning, visiting the Jubilee District Hospital. She says her role is to support and strengthen the administration of hospitals. Lindokuhle Xulu joins us now at the George Mkhari Hospital in Pretoria. Linda, good afternoon to you. So, visiting healthcare facilities today, all against the backdrop of PPE tender irregularities. What's the sense here? Is this just a photo opportunity, or do we know specifically what they're looking for?
Well, Jeremy, this is a fact-finding mission by the Public Protector's Office. You'd remember that 2 weeks ago in the Eastern Cape, that's where the Deputy Public Protector was, to check whether indeed the facilities are up to standard as far as COVID-19 ready is concerned. So what they are doing is continuing with that particular mission, setting out to ensure that all of the public that access these facilities are able to access facilities that are of quality and that are of the standard. Of course, there is also the issue of the tender PPEs, which she says they are also investigating some of those matters. But for now, these particular hospital visits are to ensure that the facilities are ready, that the facilities are indeed living up to the standard of safety as far as COVID-19 is concerned.
I suppose hospitals, when this kind of thing happens, are always going to put their best foot forward, though. Has she found anything to worry her?
That's the concern, Jeremy, because there is a media statement that was released, in fact, as early as yesterday. So this, on its own, is an informative document to these hospitals to say that put on your best behavior because the Public Protector is on her way. But what she hasn't found anything untoward in Gauteng. She did, in fact, compare it to the Eastern Cape, saying that indeed they are doing a bit better than what was seen in the Eastern Cape. But of course, there's that question of saying, what is it that the preparations that have been put to welcome the Public Protector, and indeed if we are seeing the true reflection of some of these hospitals on a day-to-day basis. And one of the things that one of the spaces that we are in right now, Jeremy, is one of the new facilities that will be handed over to the hospital, a facility that has been created to be, COVID-19 compatible. So we're being shown new buildings, we're being shown around and chauffeured, if I may, by the hospital executives. So it does seem that it's more controlled from this side. But of course, there's also an engagement with the unions to get a sense of what exactly the situation is from the workers. But certainly, Jeremy, it's very much controlled, and I don't think we are indeed going to see the true reflection of a day-to-day services of some of these facilities.
All right, Lindokuhle Xulu, thank you very much indeed in Pretoria for lunchtime.